Hello, I'm Scott Roloff, President of IntegerHealth Technologies. At IntegerHealth, we quantify healthcare outcomes for insurance companies and self-insured employers. Why? Because when you quantify healthcare outcomes, you can drive down the cost for your health plans and workers' comp programs while improving the quality of care.
This picture shows the power of quantifying healthcare outcomes. Beginning in the upper right corner, now you can rank things based upon the outcomes that they achieve. Who's the best primary care doctor in your network for treating diabetes? Who's the best surgeon for knees? Are you getting better outcomes by sending your back patients to chiropractors or physical therapists? Case managers help your chronically ill and high-cost claimants. Who's the best case manager, overall and for specific conditions? In workers' compensation, who's the best adjuster? Moving over to the upper left corner, you can optimize your plan and network design. If you're an insurance company or a TPA, you may be able to set your provider network to include only the best doctors, or at least eliminate the worst ones. If you're an employer, you can build a narrow network of the best doctors for each diagnosis. Or you can stratify the network by decreasing or eliminating the co-pays and out-of-pocket costs for employees when they go to the best doctors, who will cost you less overall and get them better care. If you have a high-deductible health plan with health savings accounts, you can even pay employees to go to the best doctors by contributing to their HSAs when they do so. Now going to the bottom of the graph, you can direct and steer care. And here there's a fundamental difference between health plans and workers' comp. In health plans, you can tell folks who the best doctors are, but they can still go to whoever they want to. In workers' comp, it's different. In 34 states, a workers' comp adjuster can direct an injured employee to a specific doctor. So if an employee injures their elbow, the adjuster can tell them which doctor they have to go see. In health plans, however, there's still a lot you can do to get folks to the best doctors. You can give a list of the best doctors to the case managers working with your chronically ill and high-cost claimants. And that's where most of your dollars are going to be. These folks will be looking to the case managers for guidance on which doctors are the best ones for them to go to. You can give a similar list to all the physicians in your network that they can use when making referrals. This is particularly effective with primary care physicians, including those staffing employer health clinics. Now these PCPs will know who the best specialists and surgeons are when making their referrals. You can also give a Finder Provider portal to the patients so they can look up the best doctors themselves. Moving back to the middle, most employers have disease management and wellness programs for their employees. They know what they're paying for these programs. Now they'll know what they're getting in return and can calculate their return on investment, not only for these programs, but for everything else too. Finally, moving back to the bottom right, with our guided analytics, you'll have visibility into what's going on that you've never had before. You'll know not only what's happening, but why.
That's what makes quantifying outcomes so powerful. If you're interested, I'd love to talk with you. My contact information follows.